Point number 5. Oral polio vaccine, as per established fact and proved medical theory uptime, may administered 3 times up to 5 years of age of the child. Fourth and final last absolute booster dose at the time of school entry time, then he never require it or all his lifetime again. In India, it is noticed that the same child, it's their parents pressurized to receive it again and again, even countless time. Even the medico-legally illegal slogan propagated "Har bachcha, har bar, every child, every time." How it is possible? Whenever and wherever health workers approach the victim child, that child succumb to swallow the polio drop without record, and how many times not recorded by that workers. Forcefully against their parents' will. Now it is court's responsibility to call the competent authorities for oral polio vaccine who propagated this illegal chant, every child, every time, har bachcha, har bar. How it is possible? It is very ill medico-legally and malpractices. So even there is no any record of date and time that how many times the same child has been swallowed oral polio vaccine within 5 years. If the court would call its documents, their all illegalities would exposed. Point number 6. Tetanus toxide blindly injected to a person whenever he consult after any kind of injury, body injury, trauma, by private GPs, even government health centers, inject it without taking previous history of TT toxin administration, that how many times annually he took it already or how many weeks earlier he took previous dose. Even countless dose a same person receives whenever he injured in his body multiple trauma or a very simple trauma or injury, and ask the medico even 100 times annually, which is against its established medical theory. After injury, if the tetanus virus has been entered, then the toxin would cause his infection more serious, and it would proved fatal for that person. Also, the same risk is in corona vaccine, any type, in any other corona vaccine. If injected during corona incubation period, so without confirmation of symptoms or detection of infection and its incubation, he would be treated for relevant injection instead of vaccination, or instead of injecting TT-IM. The same mistake is practiced about rabies. When after dog bite any person has been entered in his body the rabies, so at that time, as per medical theory, he would not be administered rabies vaccine but anti-rabies treatment he requires. Point number 7. Hope the fast, positive, proper action, because the matter related to personal liberty, safety for whole humanity, for 130 crore of Indians, life-threatening challenge by improper medication or by improper way of violating medico-legally aspects of vaccination, The matter is not about any or some people or few families or any limited sect or minor set of people or some nation or few countries, nor it is personal, but it is related for all humanity, risky for human population, their physical, mental and spiritual health and survivance by corona vaccines, but affect and new variants.